Hi, I'm Dr. Jason Morris. I'm going to be going through a procedure with you today called a Central Venous Line Placement. So basically what this means is we're going to put a catheter in a vein so that we can take blood out of your body and put blood back into your body without having to stick you every day. A central venous line is a piece of plastic tubing that typically enters your neck into one of the big veins inside your chest. So the way this procedure works is we'll have you come to the department. We'll place you very comfortably on your back on an x-ray table. We'll use an ultrasound machine to look at the blood vessels in your neck so that we can pick the best vessel to try to go through. Once we find the perfect vessel to put the piece of plastic tubing in, we'll clean off your neck, and then we'll put some drapes over you that are sterile. Then we'll take a little tiny skinny needle and administer some numbing medicine called lidocaine. So the lidocaine is going to burn a little bit like a small bee sting, but it will numb the tissue, so the rest of the procedure will be relatively painless. After numbing your neck in the correct spot, we'll take the ultrasound machine and we'll actually watch a needle go into the vein that we choose. After getting the needle in the perfect spot, we'll take a wire and put it through that needle. We'll take the needle out and we'll put the catheter over that wire. After we put the catheter over the wire, then we'll use an x-ray machine that will come across over your chest, and we'll watch the catheter go down to the perfect spot inside your body. Once we find the perfect spot for that catheter to be placed, we'll take the wire out, we'll suture it up right here, and then that'll be the end of the procedure. Obviously, there are potential risks and complications associated with doing any procedure, and including this procedure. There's risks of excessive bleeding, infection, allergic reaction to any of the materials that we place on your skin or the medicines that we administer to you. During central line placement, there's also potential risk of accidentally puncturing an artery instead of a vein. And in that situation, we have to hold pressure on the artery for a long period of time. There's also a potential risk called a pneumothorax, where sometimes the wire that we place inadvertently punctures the lung. Obviously, we're going to minimize all the risks and complications associated with this procedure, and we'll be right there with you in case any of these are incurred. Throughout the procedure, you'll be able to talk with us. So if you have any questions during the examination, please feel free to ask me or anybody else that's helping in the room.